pill for men to swallow. A look at whether they'd be willing to take birth control.
She looks like she could be the theme of every classy magazine. Well, that's her thing, but I'm not worried, 'cause I could be your first real kid. Oh, here I am.
Hello, everybody, and welcome to Better. I'm Audra Lowe. Today, we're giving your closet a makeover. We're going to actually help you finally get organized for the fall. And just how wide is the gender gap? He said, she said, on everything from sex to politics. But first, breast implant surgery is something that a lot of women wonder about but might be afraid to ask. So we headed to a Manhattan plastic surgeon to get the A, B, C's, and yes, D's of breast implants, and also demo a new high-tech device that can show you your after photo before you even ever go under the knife. Breast augmentation is the most common plastic surgery in the U.S., with over 300,000 women going under the knife every year. So we met up with Manhattan plastic surgeon Dr. David Rapaport to get the A's, B's, C's, and even D's of breast implants. First, you'll want to find a board-certified plastic surgeon to sit down with and talk about your needs.
And it takes a little bit of communication to find out what a woman's goals are. And it's that communication in advance of surgery that prevents me ending up with a dissatisfied patient.
Next, you'll need to decide on size. In this case, bigger isn't always better.
You know, I had some of my teachers in residency who would be somewhat chauvinistic and would say, just every woman, just make her bigger, give her a size bigger than she asked for, and what I want is for her to look at herself afterwards and go, whoa! But I have plenty of patients. I'm on the Upper East Side of Manhattan. I have corporate people, people in different walks of life that really don't want to stand out.
Traditionally, doctors will have a patient place different size implants inside a sports bra to test them out.
And they look in the mirror and look at themselves, and very often they'll put on their clothes on top. And it's just, see how you feel. How do you like this? How do you feel in this?
But now there's something new and high-tech to try, a device that will create a 3D image of your torso and allow the doctor to illustrate different size options on screen.
There are 6 cameras that take a 3D image of the woman's breasts and then process it on the computer after I give it some guidelines in terms of the borders of the breast. And then it's using a lot of high-tech mathematical models and actually putting in to her body different implants, specifically based on manufacturer, size, and style. This way they have a visual ability to look at themselves third person and see what will I look like after my operation, and for those women it's extremely useful.
In addition to size, you'll also have to decide on implant filler, silicone or saline, and Dr. Rapaport says this decision usually depends on your body type.
The woman that's good for saline is a woman who has a good amount of breast tissue, maybe a B cup, a solid B cup, who has a decent amount of body fat. That doesn't mean she's heavy, it just means she's not really lean, really skinny. Silicone is better for that really thin woman because it's going to show less ripples on the side and it's going to feel generally softer. But based on historical information, in 10 years, silicone probably has a slightly higher chance of hardness than saline.
Another bonus for saline patients, a smaller scar, since they can be filled up after they've been implanted.
This comes empty from the factory, so I can roll it up, and it can be very small when it's put in. This comes the way it is, so it has to be squeezed in through a hole.
And lastly, women need to consider all the risks.
I have never had an infection requiring removal of the implant, but I tell every woman that's possible. There are issues relating to rupture. There are issues relating to the scars. There are issues relating to the risk of bleeding. A woman needs to have real information. I mean, this is a real operation.
Dr. Rapaport believes with clear communication and knowledge of what to expect, women can find a new sense of self after augmentation.
This operation can be very restorative or could give you proportions that you really want in terms of wearing clothing and getting out there. So it can boost confidence. It really can do tremendous things to a woman's self-esteem.
Well, right now, the Axis 3 simulation machine is only available at a few plastic surgeons across the country. For more information, you can go to our website at bettertv.com. And now it's your turn. We want to hear from you guys. Let us know if you could change one thing about your body, what would it be? Log on to bettertv.com and then click on the question of the day. And don't forget to include your name and where you live. Now on to Better Today. You might be considering fake breasts, but what about fake friends? In Japan, the rent-a-friend business is booming. Yes, there is one. If you need a best man for your